Hello parents, this video is about how to make feeding situation easier to help your child towards independence. My name is Mary, a professional occupational therapist, and I'll guide you through. To be able to eat independently is an important milestone in the children's development. Your child is finally able to take control and responsibility over the speed and the amount of eating. Children with disability might be struggling to hold a cup or a spoon during eating. To enable them to eat and drink independently, it is important to make some adaptations on the items that you use, like cutlery, cups and plates. In our video on feeding positioning, we pointed out on the best feeding positions for your child during feeding. It is important to take note of this feeding positioning as they will influence how the child holds the spoon or a cup. Let's start with cutlery. If your child is not able to hold the spoon because of limited range of motion of the hands, then you can increase the size of the handle that they are using. Some of the materials that you can locally find to adapt your spoons might include this protective gear for the electronics that you buy. It helps in wrapping the electronics, or you can as well use some masking tape. You can use a cutter or a knife to cut the box in shape. The size of the adapting material might depend on your child's hand and how tight it's supposed to be when holding a spoon. Once you've cut out the shape that you need, just push in your spoon or knife or fork inside. Not the perfect, but it's good. This makes it easier for a child to hold the spoon in place. You can as well use a masking tape to wrap it around the spoon. This is how you wrap it around, and it also depends on how big the grip is supposed to be for your child. You can as well secure it with isolation tape at the end of it. When your child is not able to turn their wrists when they are scooping their food towards the mouth, you can as well turn the spoon to aid with this action. This is how you can be able to do that. This is the spoon that I turn round, so we have this degree change of the spoon. So this degree change will depend on how far your child is able to go or how much limitation they have on their wrist movement. It will be easy for the child to eat if they are not able to turn their wrists. If your child is not able to hold the spoon in place, you can as well use a clean hairband to help secure the spoon. Get a clean hairband, put it around the child's wrists, and then turn to put the spoon in, like that. Then put the spoon in the hand. Then they can easily scoop their food. When it comes to drinking, the form of the cup that your child is using is very important in helping them to drink independently. Therefore, I show you most common challenges and how to go about them. When your child is not able to tilt their head like this while drinking, then they will have a challenge to get all the liquid out of the cup. Get a plastic cup and make a cutout for the nose like we have done here, to help your child when they're drinking any liquid, they can get it all out without tilting their head. You can do different sizes of the cutout depending on your child Like you can see, this is deeper and this is shallow. If your child is not able to tilt their head, you can as well use a straw, so they are not going to tilt their head and they can still drink independently. You can as well use a bigger straw for children who are not able to get the liquids through the straw, or you can still cut out the straw to help them have a shorter distance while sucking the liquid in. If your child is not able to hold the cup, you can as well try a cup with 2 handles or one. That will help with making it easier for them to hold the cup. This is an example of a cup with 2 handles, and sometimes you might need to help the child to get grip of the cup so that they can independently drink. The weight of the cup is also important to look into. As for children who have tremors, a lot of shaking, it will be important to use a heavier cup that will help them control their movements. Children who have weak muscles, they might need a lighter cup as compared to a heavier one because they are able to easily lift the cup and drink independently. The next thing that we need to do adaptations on is the plate. Your child might find it difficult using the plate as it's moving around on the table, or is not able to scoop the food because the edges of the plate are too low. For example, we have 3 different plates here. This plate might not be ideal since when your child is scooping their food, they cannot be able to get hold of the food. The edges are too flat. This might be ideal because the edges are deep, but the problem is the plate is too light, and also looking at hygiene, it's a plastic plate. This plate is ideal since the edges are deeper and it's a melamine plate. For example, when the child is scooping, it will be easier for them to get hold of the food because the edges are helping secure the food to the spoon. If the child is not able to eat since the plate is moving around the table, you can use a non-slip material to aid in holding the plate in place. So if this is the plate and the child is eating, then it's going to move around when they are trying to scoop their food. Once you use a mat that is non-slip, it will aid in holding the plate in place. When the child is scooping their food, the plate is not moving around. This is a mat that wipes the table, so when you're using it, you just put it in water a little so that it can stick on the table and also on the plate. You can as well use this type of material. Just make sure that the material you use is not going to slide on the table and it can be cleaned easily. Remember that these adaptations are specific to individual child, and if you find any difficulties in finding the right adaptation, consult with the occupational therapist to give you advice on it. Bye!